Good morning, everyone. We would like to welcome our guest speaker, Dr. Erin Berman. She is a clinical psychologist at the National Institute of Mental Health in Bethesda, Maryland. She received her clinical psychology doctoral degree from Rosalind Franklin University, the Chicago Medical School. Her clinical training continued with attending the Boston Consortium of Clinical Psychology, where she was a Harvard Medical School Fellowship recipient. She completed postdoctoral re-specialization in child and adolescent anxiety disorders at Temple University. Her main area of interest continues to be in cognitive behavioral interventions with children, adolescents, and adults with anxiety disorders. Dr. Berman is a clinical psychologist at the National Mental Health the National Institute of Mental Health in Bethesda. She actually has done several webinars for the Family Resource Center, and we're so happy to have her back with us. At the end of the presentation, Dr. Berman will be answering questions that you all might have today. You may submit a question at any time during the presentation using the Q&A feature in Zoom. Welcome, Dr. Berman.
Excellent. Well, thank you so much for having me, and more importantly, speak on a topic that really, I guess, affects everybody, and specifically worry and anxiety, as people probably can just imagine, has only increased, but probably changed to some extent since the pandemic. So I will touch upon how the pandemic did impact mental health, but also more importantly, my main area of expertise is helping families, kids, and adults to manage their anxiety. Thank you for having me. And again, we're in Bethesda, Maryland, not too far down the road, and it used to be during pandemic time, much quicker drive. Now it's back to probably the normal drive to find us. But we are a government-funded institution. And, it's important to know that we are a resource that you're all welcome to reach out to if you have any more questions or, want to understand more details about how we study anxiety or a number of different mental health issues. So let's just get on. Next slide. Okay. Main reason to have this screen is for everyone to understand that anxiety looks different in every individual. There is no one typical presentation that you will see in a kid, adult, caregiver. So really understand that one of the most important things that these images are showing is the one where, we're listening or talking to people, most importantly, listening to people, but also looking and watching our behavior, our child's behavior can be indication of when someone's experiencing anxiety. So a lot of people ask one of the main questions, how do I know if my child is anxious or my friend or my partner? And one way is by looking at behaviors and watching how people, interact with their environment. This data, which was more recent with the CDC, shows depending on, the age range, what is the primary diagnoses that you're going to see. And when I talk about depression, anxiety, and behavior disorders on this screen, we're not talking about everyday anxiety or stress around a test. We're talking about disorders that when anxiety or depression is classified as a disorder. A quick way to know or that we kind of understand disordered anxiety or excessive depression is when it gets in the way of our daily lives, and that happens on more than like a 2-week basis, right? So it's not just we have a bad test or an argument with a partner or falling out with a friend and our anxiety is up for a couple weeks or our sadness is increased for a couple weeks. This is more pervasive, and usually with the CDC and with us with National Institute of Mental Health, we look at these symptoms that are going to go on for more than a month, most likely. So as we can see, depression mainly really hits a rise about 6% in the teenage years if you look overall. Then when you look at anxiety continues to increase steadily as children age, and you can see that higher push, almost about 11% of kids will be diagnosed with anxiety disorder on the ages of 12 to 17. So that's a pretty high rate. And then behavioral disorders, which we're talking about attention deficit, hyperactivity disorder, or conduct disorder. It seems to be 6 to 11, those mid-year ages, that you'll see an increase in that. But these are pretty high numbers overall. And in general, the rate of depression and anxiety has only been shown to increase over the past 10 years in kids. Also, really important, this is the adults, this is all of us. Many of us are not foreign to anxiety, but anxiety disorders are the most common mental illnesses in the United States, affecting 40 million adults, about 20% of the population, age 18 and older every year. So that means at least 20% of the population would be diagnosed with an anxiety disorder during a year. So we're all kind of, in the same boat, that this is a very common disorder. The things that are important to know is that they are highly treatable. We have good interventions for anxiety disorders. There are also been years of research on medication. So there's effective medications on anxiety disorders. Again, I will only touch upon the behavioral interventions, but only about 36% of people suffering receive treatment. Why is that? One, it's pretty common. Two, access to mental health is still an issue in this country. People with anxiety disorders are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for a psychiatric disorder than those who do not suffer from anxiety. The top one's important. And I will get into more details and also how do you manage these physical symptoms, but anxiety has a strong physiological component. And so many people will believe they may be having a heart attack, having issues with headaches, stomach aches, sleep. And so they will probably hit their primary care doctor many times before they'll hit a psychologist or psychiatrist. Anxiety disorders develop from a complex set of factors, including genetics, brain chemistry, personality, and life events. So there is no one main reason that these happen, but that everyone understands that it's part of anxiety is part of why we, stay alive every day. So it's really normal to have anxiety. We want to have it because it motivates us many times, or at least me, to get up in the morning, to get to be places on time. I kind of, a little more lax with time, but it's very important. Today was a perfect example. Presentation, needed to be on the Zoom at 11 to make sure everything was running. If I didn't have anxiety, maybe I would have been still, sipping my tea or coffee 10 minutes after, but it gets you motivated. It gets your body moving. And so that's an important thing to understand, that it is an important and very useful emotion, and we just have to figure out how to manage it. Why I have this very technical image of the prefrontal cortex is to help us understand how kids will cope with anxiety and how you can help them have better skills to cope with anxiety. Most important is the front of our brains was the last to develop evolutionarily. So that is where we do all our complex thinking. We think about planning our days, organizing our schedules, thinking about the future. It's how we can think about the future. It makes us different from a lot of other animals, this front part of our brain. If you can see very clearly, and all of you are here because you have children to some extent, is that the 5-year-old brain, as we all can remember, or if we currently have a 5-year-old, is pretty tough to rein in, right? They do all kinds of things, body all over the place. And that's because that part is not fully formed, right? The preteen brain is getting a little bit bigger, a little bit stronger, those connections. We're starting to have a little bit more control of our body, right? So if you look at those images at the bottom, it's less mature is the red, all the way to the purple, and blue is more mature, meaning those abilities to plan, prioritize, control impulses. And our last one, rational thinking, which is what really is helpful against anxiety, really are not fully formed until you're about in your 20s, right? And I think we can all relate that it is challenging. And for some people, these skills of planning, prioritizing, controlling impulses and rational thought are hard just naturally, right? And part of that's due to some things like personality, some can be due to anxiety disorders, and some can be due to attention deficit hyperactivity disorder. So just so we have a lot of grace and understanding of why our kids and even our young adults may not be thinking so clearly sometimes. But what we can do is train the front of our brain, right? And that's what we're going to help coach our kids to do, or ourselves. Also to remember, as you could see with that last slide, in that year of 5 to 20, like 15 years, our brain is really plastic. It's growing all types of connections, right? So what we want to do is start to really foster these things that really are not coming naturally at this time. We have, when our front of our lobes are just starting to get developed, we have something called reward sensitivity, right? So when something feels good, we just do it, right? When you think about the ages of actually 0 to 25, we're very sensitive to what feels good. So we want to help kids understand the different emotions that make us feel good, right? And our brain is very, very tuned into what feels good and what feels bad. As we get older, we can control that and have a more neutral take on life. But fostering positive emotions, relaxation, happiness, humor is a really good thing to think about in these ages range of 15, well, 0 to 20, as a good coping skill. Understand too, though, that they have difficulty seeing the whole picture of their behaviors and also what's going on. I say cross training is important. What do I mean by that? That these kids talk to a bunch of different people to get perspectives. Teachers, grandparents, religious leaders, coaches. We want kids to start to learn to get different perspectives. When we are anxious, when we are stressed, when we are depressed, we have tunnel vision, right? We know that from research. We kind of just have to have a hyper focus on what is the problem in front of us. We as adults, because we've lived a little bit longer, many times can look more at other aspects of the picture. And we want to help them understand, how do you gain perspective? Perspective is one of the best things you can teach as you're growing up, to help get out of that tunnel vision that we all have when we're anxious or stressed. And the last one, so there's so much development. These kids have to get so much sleep. Sleep causes all kinds of issues and has an impact on mental health extensively. So what do we want to do? What can we just do on a daily basis that will have subtle effects on coping and dealing with anxiety, right? As I said, and I have kind of big topics that I'm going to cover, not a lot of detail, because I do think every person, every family has their own way of teaching these skills. And I will go over how I teach them, but any way that you can get to these, I think, is a great way. So modeling behavior and problem solving. When we all get anxious and stressed, as I said before, we tend to just go tunnel vision. Either we have the answer or whatever's happening is catastrophic. We can show our kids, because kids watch us more than listen to us. I don't know if anyone else has that problem as a parent, but when I'm lecturing or explaining, my kids are less likely to look at me. But they are watching all the time, although it's scary, what we're doing. So I try my best, not always perfect, I'll tell you, if I'm running late for something, or if I forgot to pay a bill, modeling, how do I deal with feeling stressed? And then how do I problem solve? Again, when a child is feeling anxious or stressed, they feel there's only one option. They feel very trapped. From working for years with patients over and over again, they feel like there's no other way to see things. This is either a catastrophic outcome that I've failed this test, or I cannot say hi to this person. This feels so awful, versus all the middle ground that they're in. So model behavior and problem solving. Fostering social connections, like I mentioned, whether it's with peers or other adults that you believe are good models for the kids. Positive peer support transfer is a really important concept that may be hard for you to implement as their parent. It's easier for teachers or coaches, but really letting kids talk amongst themselves of how they deal with problems. Obviously, we have to have some level of, listening, and some of the ideas that peers have might not be great, but letting people know. I think we can all relate, talking to either a coworker family member, friend really helps relieve that stress. So encouraging positive peer support. It does take a village. It doesn't just have to be on you as the parents, and boundaries modeling. So we want to make sure, and one of the topics I'll go into a little more depth is when a child has anxiety and stress, they're going to push the boundaries of what attention they need, right? So they may really heavily rely on that primary caregiver or that person they really trust. When we can't solve all their problems, we have to teach them how to problem solve, not solve them for them. I'll say that again. We have to teach them how to problem solve, not solve them for them. Now, if you have a 5-year-old, totally different. You have an 8-year-old, can't think of all the issues of ways to solve a problem. But we also have to show them, and that's what I mean by boundaries. I don't know if that's, it's just showing that we can't get too sucked in to their anxiety. We have to help them understand what they can do on their own, because anxiety robs kids of feeling that they have agency and ability when all these kids have the ability inside of them. And so that was just the basics. And then we had the years of COVID, which are now, I have to say, most people reporting not these classic things that obviously were impacting us 2 years ago, right? So 2 years ago, the physical distancing was leading to sadness, depression. Kids were not having normal outside activities from their home. That was leading to depression and anxiety. Online school was sure frustrating everyone involved. Working from home was challenging, salary lost, and also the impact on minority communities was terribly stressful. Those things, to some extent, are starting to loosen up, and some extent not. But what a lot of people are reporting, and this is more just from working with the parents, are just burnout. They're tired. This was a lot for people to deal with for many years. And now we're jumping back in to as normal as it's going to be at the moment, and people are having a hard time managing that. So having grace and understanding for your kids and yourself right now, that we're all figuring this out as we're going right now. So how do we know? I did start at the presentation. Sorry, I'll back up. I did start out the presentation with what are the rates of excessive anxiety and depression, but how would we know? What would we see in our kids? What would we see in our partners, or even in ourselves? So worrying before and after events, thinking about, what did I say to that person in that social interaction? Teens do that a little bit, but when they're thinking about it all day long, about worrying that they said the wrong thing, or worrying ahead of time for days in advance about a party or a test, not just a little bit before. Again, we want some anxiety to help us get moving, but too much will interfere with our attention and our ability to enjoy things. Irritability, cranky, and beyond the normal like teen ebbs and flows, more chronic irritability can be a sign of depression and or anxiety. Problem sleeping is also a big one. That also leaves them vulnerable to increases of anxiety and depression. Problems being alone, this many times is for our littler ones, but I definitely see kids around 14, 12, 13, 14 with separation anxiety disorder. That has become a little bit more prevalent for me, the older ones, because they didn't have treatment, or it was difficulty to learn to be away from their primary caregivers during the pandemic. So I'm seeing a little bit of an increase in that. They don't like being the center of attention, having eyes on them. So whether that's in the sports type of an event where they used to love to play basketball, but they're uncomfortable having everyone look at them. Specifically, another one in school would be giving a presentation, or next one, having to raise their hand in class, avoiding asking questions, and then having challenges in school because they're not getting all the information they need. Being very self-conscious, excessive. We're all self-conscious to some extent, specifically in the teen years, but really hyper-focusing on how people think, how teachers think, how coaches think. Panic, which we'll talk about a little bit more specifically in the next slide, having more panic, physical symptoms of anxiety, freezing, so being unable to do things they used to do, or just not knowing how to move forward with tests, exams, homework, saying hi to someone. Freezing is kind of a big word, but that's kind of what I'm implying there. Worry, butterflies, so physiological symptoms in their stomach, feeling uncomfortable, fight or flight response, which we'll talk about in the next slide, problems concentrating, and so many more. These are the physical symptoms of anxiety. They are bona fide. This is all in our body. No one is making this up. If anyone has these lovely Apple Watches, Fitbits, any of that stuff, you can see your heart rate increase when you start to get anxious. You can see that breathing increase when you start to get anxious. And these symptoms are an indication that we're starting to feel nervous, uncomfortable. Kids will complain a lot about stomach aches, headaches. That's another sign that you could be having anxiety, generalized worry, or also panic, feeling like they want to get sick, nausea, having to go to the bathroom a lot, peeing, like just having that urge to go can be a sign that we're anxious, tightness or pain in chest, sweating, heart racing, dizziness or lightheadedness. All of these things are when our anxiety turns on, and anything can turn that anxiety on. It could be a big black bear. I don't know, there was one in like Montgomery County right now. I think my anxiety would turn on if I saw a big black bear in my backyard. Or a test, or public speaking, or saying hi to a new friend. All of these things can increase anxiety. Remind yourself, and this is what to do if your kid is having a panic attack, if you are having a panic attack, if even you're having a stress attack. These are kind of the four main rules that will help this process end a little more quickly. First of all, you cannot stop. Once a panic attack has turned on, once your anxiety is kicked in, don't try and stop it, right? What I mean by that is there's that old experiment that was done where, and you can practice this with me or not, is, they put people in a room and they said, close your eyes and do your best at this moment to not think of a white bear. Do not imagine a white bear. Do not think of a white bear. Push it out of your head. And the more you try not to think of something, it pops up even more. That's what I mean. You can't stop it. That doesn't mean it's not going to end. Listen to your kid or whoever's next to you. Let them talk. Don't talk too much. Okay. No one's listening. If you see that image, all this stuff is firing. You can't calm them down. You can listen. Try and be calm. Hug. Stand calmly. Have a calm voice. Be a calming influence. That will make it go down a lot more quickly. It does end. No one's panic has stayed up here forever. I can tell you, it always goes down. And the last thing, which I won't go into details because you could Google these different tools, but the big word is called grounding. What that means is getting someone back into their body and calming down, tapping into one of the five senses. So, go get a nice cold cup of water for them. Have them go outside for a walk to look around. Take a cool shower. That will help it calm down, and that's better than any of the talking you can do. As we said, anxiety is adrenaline, cortisol. It's a signal to say something is up. We really want to look at it as a signal. And sometimes it's helpful, right? Categorizing or labeling these emotions as good or bad is not helpful. So what's up? It tells us to look for help. Go to our parent, or if we're not doing well in school, go to our teacher. Remind us. So we really want to look at anxiety as something that's not going to go away, but we don't want to encourage it. These are all normal and it will pass. And we don't, as a parent, do not always have to fix it, right? We don't have to go in and fix this. Most of these kids, actually all of these kids, are capable, have it inside them to figure it out. We need to be like coaches and really encourage them to think, what is the way that you think you can solve it? Okay. So back to it, we want to have people have a better relationship with anxiety. We don't have to like it, but we also don't want to push it away too quickly. We want to support kind of a different mindset for our kids, right? We want them to understand that, being self-critical, worrying about the future, and being perfectionistic can be challenging. This specifically goes hand in hand with the diagnosis of generalized anxiety disorder, which is a pretty common diagnosis for kids and adults. It's excessive worry, worrying about the future, worrying about how bad things can be, and really holding ourselves to an unrealistic standard. Okay. So, with this type of anxiety, at least from my work, I've had a hard time, really being able to challenge these thoughts. This is very ingrained in the individual, and that's fine. As I always say in therapy, I'm not to change your child or yourself. We want to use these powers for good and just rein it in when it gets in the way. And being too self critical will lead to us being depressed and upset. We want to think of making mistakes in a different light. So that's why this is one of my favorite slides, or my favorite quotes. Experience is the name everyone gives to their mistakes. If we could look at having more experience when we make a mistake or we fail versus a failure, then we might feel a little bit more free from our anxiety. Perfectionists, I want to lay out, can look two different ways in school. They can either be my kids, my patients that are overachievers, that meaning they are spending too much time doing notes and studying, or it can look just like those kids that do nothing, right? That avoid. Okay. Avoidance is a big sign of anxiety, specifically excessive anxiety. We all avoid things here or there. Sometimes, oh, well, I went to a parent event yesterday and I avoided some people, but not everybody, right? So it is okay to have some level of avoidance. But in school, we see these kids just not doing their homework or not taking that test. Because if they don't do it at all, then they don't have to look at the mistakes they might make, if that makes sense. So just so we know that anxiety is really complex in each child, and to honor it and figure out how to work with it. But the more we can model that mistakes are okay, the better. Anyone can tell I'm a big sports fan, and this is one of my favorite quotes because, now again, we all can't be Michael Jordan, right? And of course, he probably was a perfectionist, meaning in his work and how hard he worked. However, his mindset, this really taps into it. So I've missed more than 9,000 shots in my career. I've lost almost 300 games. 26 times I've been trusted to take the game-winning shot and missed. I've failed over and over again in my life, and that is why I succeed. Now, again, we can't all be Michael Jordan. However, it's important to know, however, we want to tap into that we are going to make mistakes, and that is where we learn, not where we label ourselves as failures. And regretfully, anxiety jumps on that very quickly. I always say anxiety is slippery. It wants to stay alive. It wants to tell you that you are, this is a catastrophic thing or you did something horrible, when that's not the case. So what do we do as parents? Again, see, I have to move this so I can see. Change the way we relate to your anxiety and their anxiety. We have to watch our kids mess up. We have to let them learn on their own. Now, we can add ideas, but we can't kind of hover around them too much so they never learn. The other thing that I mentioned at the beginning is, who else can they go to? We want kids to know there's more than just us, if that exists. Someone who's trusted, but you help them figure it out. Teachers, parents, therapists, pediatricians, friends. Who else can they tap into to learn? We don't want to be, I guess what I'm really getting at is just one person that helps them solve or deal with their anxiety. Because sometimes we can't be there. And what that does is reinforce to the child that they don't have the agency, the ability to work on this on their own. So approach the strong emotions, whether it's depression, but more likely stress and anxiety, as a coach for them. Again, we are the experts on our kids that we live with, but we don't want to act that way sometimes with them. So active listening and helping them express their feelings. What are you feeling? What thoughts are you having? And what's your body saying, right? That's one just basic active listening. Don't going in and fix it. Just listen can be very powerful for your child and help them reduce their anxiety. Role-playing social situations. This is going to more fall into the diagnosis of social anxiety, where kids are nervous about either saying hi to a peer, talking to a teacher, really interacting with people they're not as familiar with. What has been very powerful in my work is just listening. Well, what's the situation that you're nervous about? The kids can tell you pretty actively. Oh, there's, I have to present my poster tomorrow at this cultural event. I'm very nervous. I'm afraid no one is going to come up to my poster. And I don't know what I'm going to say. Oh, well, we can practice, right? And you practice what they can say. You can also have practice if no one comes up, what they could do. Maybe they can get up and talk to a friend. Maybe they can go take a break in the bathroom. What anxiety does, like I keep saying, is it makes them have tunnel vision and think, oh, no one comes up to my poster. It's going to be embarrassing. And I'm going to hide under the table and run away. Let's help them think of other ways and role play it if they feel open to it. Another thing that we do want to pay a lot of attention to, and now this is more and more coming up in the news, is discussing social media, right? What is real? I was listening to, there's a special on Netflix with Michelle Obama and Oprah, and it's excellent if anyone has free time. But they're talking about how Michelle Obama was talking about when their daughters started to have social media, and she looked and she had 1,000 friends, and she said to her daughter, "No one has 1,000 friends," and I mean in that way. In terms of close people we interact with, no one has that. We may have that many followers, but not many friends. So really having kids have a reality check with social media. And as we said, besides ourselves, we want to help kids identify other people, whether it's the counselor in the school, the front office person who runs the front office many times. Who else can they talk to if they're feeling stressed? They don't have to just go home. The answer is not all or nothing when it comes to anxiety. Be flexible with your expectations, right? Make sure we understand that sometimes when the kids are dealing with excessive anxiety, they're not going to complete all their homework. They may have trouble staying on task. They may not get the grades that they really even should, but that we need to figure out maybe more on what they are accomplishing versus not. So, prior to the pandemic, our views were much more rigid. I hope we're all starting to be a little bit more flexible and have a little more grace with each other. What kids with anxiety need to know. So if you can impart this into your child, this is terribly helpful. So, and again, you don't have to use these exact words, but it's kind of the theme I hope you're picking up, the big overarching theme you're picking up on this. All these kids, and even ourselves, we can do hard things. So you're brave. You are resourceful. You're a thinker, right? Remember, we have to tap into the front of their brains, not that base emotion that's kicking in. Because when we feel anxiety, it feels really bad. But we can push through it. We are brave. We can problem solve. We can think it through, right? So those are really the three main things I teach my patients. You can ride through a very strong and awful emotion, right? You can problem solve, right? Okay, well, you failed that test. Is that the end of the world? Sure, it feels like it. But a lot of teachers are reasonable. Or we can just retake that class. Does it sound fun? No, but it's not the end of the world. And you're a thinker. What's a more rational response that we want to push back on our anxiety? You have everything you need inside you to cope with things brilliantly. Don't let your mind tell you that you can't do hard things. And that's many times what our mind does. And anxiety, that emotion, it tells us avoid, stay away, freak out, right? Because you absolutely can. So we as parents, coaches, caregivers, teachers want to take, I guess that image is what we don't want, right? Where you're right over writing for your child, where you're filling things out for your child, right? We want to provide support versus protection. There are some things we need to protect our children against, but more importantly, we need to let them know that we're here to help them, but that they can do hard things. So empathy, empathy, empathy. Listen, listen, listen. You do not have to be the problem solver. That is what caregivers, coaches, teachers do. We want to solve problems. I always want to solve my kids' problem. When my daughter says, I'm worried about XYZ, oh, you can do this. Oh, you can talk to this person. Oh, I just jump in. It is very normal and natural. We want to step back, not all the time, but if we start to hear that they're having excessive anxiety and listen, then go, I have faith in you, and slow down and figure out what's going on in their head. Like I said, it may simply be, I don't want to put this poster up because I'm afraid no one's going to come look at it. Okay, sure. That's valid. Let's think about what we can do when that thought comes in and what you can do if it really starts to happen. So thoughts and problem solving. The other really important thing for us to push is making our kids face their fears, whatever makes them scared, as long as it's not inherently dangerous. They don't have to jump out of a plane, right? But it might be talking to new people. So, what can we as caregivers do? We can start to help them find opportunities to talk to new people, right? So, with my kids, I'm walking them to school. I take them to the crossing guard. They're always looking down. They're always looking down. Now, I'm not saying, hey, 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 say hello. But first, I start modeling that, right? It's clear they're nervous to say hi to someone new. Then I say, hey, let's say hi. Okay. Then they won't say hi. Okay. Let's practice it first. So when we start to see the things that scare them, we want to start to push it. Maybe it's for the teens sending an email or asking a question to their teacher. Maybe we'll start gradual steps. Okay. You don't want to raise your hand in class? Can you send an email? Oh no, mom, I can't do that. I hear that all the time. Okay. Then that step would be, I will sit next to you as you write that email and I'll check it, but I'm not sending it for you. We're talking more about the teens, not the little munchkins, right? But we want to slowly push them. The kid is afraid of going to sleep alone. Usually those kids are also afraid of going to parts of their house alone. What do we want to do? Maybe we'll have them go get something from the basement for us. Again, very gradually, we want them to face their fears and obviously try and place limits on social media. So what do we want, what to not to say to someone with anxiety and what to say? These are the not to say are really common for all of us to say. Well, I'm just going to be honest. Maybe it's just the generation, but so don't say, quit being dramatic. You're just being lazy. You need to toughen up. Come on, this is easy. Pull yourself together. When are you going to grow up? You're crazy. Can't you just try harder? When we say those things to someone that's feeling anxiety, they only feel worse and more trapped. Instead, we want to try. I know this is hard for you. Just take some time. It's okay. Again, we want to start to slow this process down, right? Anxiety kicks in and we're supposed to fix it. I see more than just your anxiety. This is what I love about you. As I said at the very beginning of this presentation, the more we can find more positive emotions, more neutral emotions, and help that connection, occur more often versus that negative, because anxiety does say, this is not good, this is catastrophic. And if we're having a lot of anxiety on a daily basis, those connections get strong, right? I don't know if any of you have heard, I'm sure you have, of when we learn about the brain and how the brain communicates, neurons are what fire together. And that's what we learn when we hear what fires together, wires together, right? So if we keep having anxiety and then just feeling more nervous, that connection's going to be there more. And we have to have, okay, I see you're anxious, but this is something more neutral or positive we can do, or what I see about you. How can I help? What do you need right now? Want to talk about it. So just different ways to respond to anxiety. And most important, right, is we ourselves, right, as caregivers, coaches, need to take care of ourselves. This is also phenomenal for kids, right? And really trying our best to do some daily practice of something, right? Deep breathing will really short circuit that anxiety reaction. Most of my kid patients, so when they roll in, I talk about meditation or deep breathing, they are not on board with that. Some are. And if we can have them learn deep breathing, you can find, all types of apps or just videos on YouTube. So all of this is pretty accessible. Just Google deep breathing exercises for kids. But practicing it a little bit every day is super helpful. Like I said, back to our great things of the good and bad of technology is, having these watches where we can, check our breathing. Mine even has where you have a minute to meditate. Progressive muscle relaxation is something where you tense and relax the muscles one by one. Again, that's something you can Google and find a video online, or an app. It really helps when we're feeling stressed. One quick one that has worked really well for kids is when they're feeling stressed, or and it looks kind of funny, but it helps, is one of our bigger muscles, our shoulders, carry a lot of stress and anxiety. Pushing them up to our ears, it's one of my favorite ones. I know it looks a little silly, but holding it tight and then relaxing can really start to get the blood flow and calm your body down. Yoga is fantastic, right? For kids, for us, exercise. So whatever exercise makes them feel good. I also want us to know with this, you can be very flexible with stress reduction and relaxation. Kid plays swims, then let swimming be that. If they play soccer, that. If they like to go to the playground, it can be that. Just doing something to get the energy out on a regular basis. Clubs. I have plenty of my patients who do not want to do sports. That is fine. You want to play chess? Fine. You want to play D&D, Dungeons and Dragons? That's okay too. Any of these things can be a source of stress reduction. Music, simply listening to it, writing lyrics, playing it. Okay. Find something to do that we're not good at can be really fun. Just having fun, right? Like rewiring feeling nervous and having a different response, right? Socialization is fantastic, obviously. And when I'm talking about this, I want to always be sensitive. It's always to fit with that person. They don't have to have 50 friends. They can have one good friend. Okay. And just support, asking for help, teaching your kid or showing your kid how you can ask for help. And it's, something that is, good to model. So please take care of yourselves and your kids overall. This is us. We do see kids at NIMH, kids at 8 to 17. What we do here is therapy or medication. So a lot of the stuff that I was showing you, we look at those skills. We go into more details with the cognitive skills, how you can challenge thoughts. We do provide, everything is free of charge because we're a government institution. We're paid by taxpayers' dollars. So I know that we probably have a lot of questions, or at least a few questions that I want to get to. And please let me know if anyone has more detailed questions on specific anxiety, whether it's social anxiety, generalized anxiety, obsessive compulsive disorder, specific phobias. I only had about 45 minutes to get through it, but I wanted to get you through the main skills that would be really applicable to all those different types of anxiety. So I will take a peek at the questions in the Q&A.
Okay. All right, Dr. Berman, I do have a question for you from one of our families. This parent is curious about any recommendations for therapy for an 11-year-old child with combined ADHD and generalized anxiety. They also have executive and learning problems, and just was wondering if there was any type of, recommendations around therapy choices for a child like that.
Right. So that, just like probably most of the children that have anxiety, they have, every child is complex and has multiple things that they may be dealing with. And I'm really glad that you tap into this. This is a great example where you have an individual with anxiety, generalized anxiety disorder. You have attention deficit hyperactivity disorder, which could be causing some of the generalized worry, right? Because it's hard to have ADHD in a typical any learning situation, right? And then executive functioning issues, that's what we hit at the beginning. And that can go hand in hand with ADHD. So the general level of approach is seeing which one is most significant. I would probably look at 2 different or 3 different types of interventions to eventually work through. Obviously, for the anxiety disorders, cognitive behavioral therapy. Another version of cognitive behavioral therapy is acceptance and commitment therapy. But for 11-year-old, I would go with basic cognitive behavioral therapy to help them deal with that generalized worry. But I would also really watch the ADHD because, again, as I was saying, having that in an learning environment can be very stressful. And so you could look at an executive functioning coach for that as well. And then also sometimes after you work through the worry, you may want to look at medication options as well for ADHD. But an executive functioning coach would be able to help with the symptoms that are impacting the child in a learning environment. So I would say executive functioning and cognitive behavioral therapy for that individual, and possibly a med consult with their pediatrician.
Great, thank you. Do you have any tips for identifying and coping with anxiety for people, children who are non-speaking or minimally speaking? Often their disability results in professionals downplaying the existence of anxiety.
Yes, what a very important part. Wow, yes. So I think that one, there's a couple approaches, right? Having someone who specializes in that. I know sometimes that can be connected to individuals and kids being on the autism spectrum. It also can many times be kids who have selective mutism. And this may be with each one of those kids, but just to give someone an understanding what selective mutism is where they're not speaking a lot at school or in other environments, but they may talk a little bit more at home. So one, having someone who specializes in it. Two, I agree, having the provider understand and patience is the biggest thing. So figure out the other ways that they can communicate, right? Whether it might be, writing things down, acting things out. The other thing is, even depending on their age, if they can read and fill out a form. So instead of just asking them, I have plenty of kids that are not even that verbal, and me having to give them forced choice questions can be helpful. So do you feel nervous here? Do you feel nervous there? And just having them many times shake their head yes or no. So having someone that specializes in that, making it clear to the provider. But I would like to empathize a lot. I think it's very hard, even me who's used to it, being able to tap into that anxiety. I've definitely had kids too who are stuck in that position. Recently, I've had more middle schoolers and even ones that are less likely to come forward that also have depression hiding under there as well. So.
All right, thank you. What is the difference between a nervous child and an anxious child?
A nervous child and an anxious child. So I think, I'm guessing it's the idea of when is it kind of just a kid is more neurotic. I'll say that that's kind of the term we like to use, right? And if you look at personality exam, one of the better personality tests, it's called the Big Five, has neuroticism right on there. So where are you on your level of neuroticism, right? And then there's anxiety. Neuroticism can be more of a personality trait. So it's pervasive. It's a kid who might be a little bit more conscientious, thoughtful, thinking a little bit more about the future. But when it hits anxiety,
Um,
mhm,
no, thank you.
like when it hits anxiety, like anxiety disorder, that's where it is really impacting things that the child needs or wants to do. So you could have a nervous kid, but they still go to school, right? Or they still participate in that class, but they're thinking and chewing on it. It's more when there's avoidance of things they really need to do. I would start to say it's hitting more an anxiety disorder, right? Avoidance, interference, or distress, right? So you're not just hearing them chat about it, that they're nervous. They're throwing themselves on the floor, or they're locking themselves in the room for hours, right? Or shutting down. Does that make sense? Kind of between a neurotic kid and an anxious kid. We kept have plenty of old souls in the world, and that's okay. So.
No, thank you. Can you talk a little bit about social anxiety and how that relates to lack of confidence in teens, especially girls?
So And I'm glad someone brought up this one because social anxiety is on the rise. They're seeing a connection between social anxiety in middle school and teen years. Partly there is a normal uptick, specifically in girls because of hormone changes, but also with social media. Everyone again thinks that what they see is what is true. So more importantly, what we want to do is identify it early if we can. So being worried about how they look, how someone talks to them, how they are perceived. Also, high school and middle school can be hard times where there is a lot of negative feedback. So, making sure that this kid has access to things they really enjoy and that can make them feel good. That's why I am really big on this slide of having just one sport, club, or music where they can express themselves and feel comfortable. Also getting cognitive behavioral therapy, or there's plenty of CBT interventions like apps and things that can help these kids challenge these anxious thoughts. And the most important one to kind of get across to a high schooler that has social anxiety is they're all thinking that everyone's looking at them, right? Um, However, really it comes down to most people are thinking about themselves, one. And then the second component, so how you think, also pushing that child in a thoughtful way, not just across the board, of having them do things that might make them scared, maybe with a trusted friend.
Great, thank you. Do you see children, or does your office, or have you run across, children with really complex communication needs and helping support their levels of anxiety?
Yes, we see that to some extent, not in a lot of detail. I usually that tends to be a different clinic than me, but I do agree that I think when there is that complex communication, that obviously leads to frustration, which leads to anxiety for the family and the child. So it's something that whatever provider is has to be very sensitive to And again, I really feel for those individuals, those kids, because there's that complexity on top of having this anxiety in their head. And a lot of times I will work with those individuals more with either listening to things about anxiety or having to read about anxiety versus specifically just having typical kind of one-on-one therapy.
Thank you. I know you had mentioned a little bit around selective mutism, and this family member is really asking about um, some strategies or tools that a teacher might be able to utilize when working with a child with selective mutism.
So that, yeah, that is a great question. I think for it is important that the teachers are aware of it and that they have flexibility. So that's the biggest thing is we don't want anyone, child, adult, to feel bad that they have anxiety, right? It's not something they chose. So having the teacher understand or start to figure out middle road ways. I had an amazing patient years ago, and the teacher was very good in understanding that maybe they needed to, instead of raise their hand in class, talk to the teacher afterward. If they couldn't even talk to the teacher, maybe it was every morning the teacher just saying hi to them, really creating a hierarchy of little steps to get to the bigger steps. That's the most important thing. And what's great about teachers, if you know the big step is having to present in front of the class, the little steps may be having the kid record themselves saying something at home and then having the teacher watch that. Does that make sense? So really creating very small steps, incremental steps, or also providing some flexibility in how we assess kids, right? So letting the kid know that they don't have to present in class, or they don't have to raise their hand, but that they send an email. So again, having little baby steps is the best thing. And then also for that parent, also, when you can have them practice outside of the home, that's helpful as well. Just speaking, talking up. And then the last one is, let's say they can't at all verbalize to the teacher, having signals of yes and no, starting out just with behavioral ways of communication and not even verbal.
Great, thank you. Um, this family is asking around the best method for getting a diagnosis of OCD or an anxiety disorder for an elementary aged child.
There's a couple routes. I usually the simplest one I usually do is go to the pediatrician and see who they recommend. Some pediatricians can diagnose all of that. Going to a psychologist is another option just in the community. And the third is you could go to get a neuropsych evaluation, but you don't need that much in depth. For a psychologist should be able to give you that diagnosis of OCD. I would look for a practice or a group or an organization that does assessments and that specializes in anxiety. That would be ideal.
Okay, thank you. Um, do you see anxiety with sensory processing disorder? Um, are there strategies like for school that have just, again, just loud noises? Our
Yeah.
children struggle with that.
Oh, 100%. That's very, very, very challenging. And there's usually two ways about it. One, obviously, the quick option is having the child have something for that in those moments, right? Do they have earplugs? Do they have headphones that they can put on? And then gradually exposing them to those sounds at levels of sound. So I know a typical one for those kids might be a fire alarm, right? And worrying and sensing that. And so it might be being home, having them listen to it at home in a calm environment or with their therapist. A sound on your computer, you can find these sounds, starting to get them used to it in a calm way versus when it's an unexpected scary way. But that one is hard, and it just takes time to have the kid acclimate to those sounds, which takes patience on both the caregiver and the kid's part.
So I have a parent here who's very concerned about their 13-year-old with autism spectrum disorder who's had suicidal ideation in the past. Is really more focused on just wanting to watch TV, doesn't want to do any of those physical activities
Mhm.
anymore, coming home tired from school. It's- I think the family's concerned about whether is this anxiety or depression and how might they maybe get some answers for that.
Right. I mean, it probably is a combination of both. Do you know? Like I would bet it's very challenging to I always am so empathetic for these teens because it's hard to be a teen. First off, and then with that diagnosis, it complicates all types of social interactions. And I understand that probably coming home from a day of school, they're drained. And then being drained leads them to be avoidant. And then if you're avoidant, then you get depressed. So it's probably a cycle of anxiety and stress in school. And we know many times that that alone can then lead to feeling more depressed and alone. So the more you can get them out in the afternoon, getting them out of their room a little bit. And then the other option is thinking about what other interventions might be helpful that they're open to, whether it's some type of therapy or medication sometimes. But my bet from what you're saying is the anxiety can lead to depression in this case. And thus, that kind of those suicidal thoughts. Also, many times I have anxious kids who just will have suicidal thoughts because when they feel trapped and alone, that's kind of they feel is their only option. And it's important for us as caregivers to let them know that there are so many other ways we can help them cope in those situations.
Oh, thank you. How do you help a male teen with social anxiety who has struggled ever since COVID, but his response is often aggressive behavior? It's difficult to get him out in public.
Male teens with I struggle with that. Male teens with social anxiety is not an easy thing, especially if it's aggressive response when you're trying to push them. And again, we have to remember that anxiety is fight, flight, or freeze, right? So fight and aggression is definitely a sign of anxiety disorder in this individual. Again, baby steps, one, and then figuring out any ways that they can feel better or empowered. When I have those individuals, many times I will start with just them having more friends online and gaming, and trying to push that way, and then slowly trying to figure out what at school or club or sport, just mostly at school, where can they start to branch out? Because most likely you're saying if this is a social anxious teen who's been, you know, kind of alone because of the pandemic, figuring out where you can get them. Even well, maybe it's just even a rock climbing club where they don't have to talk to someone, but they're going out, seeing those things, and very subtle. I find try and find very subtle, slippery ways to get them out the house, because that's tough with that type of a reaction.
No, thank you. And a quick question from a parent who is asking about at NIMH. Are you specifically only doing research, or do you provide direct services to children, or is it a combination?
It's a combination. Great question. So we are a research institution. So when the kids come in, we do an assessment, right, to see what diagnosis they have. That will be initially. Then we let them know that we do ask them if they can, if they're willing to participate in research. That can be anything from basic, just like computer games that we have them play to check out the brain, to fMRIs where they can get brain scans. So we ask them to do it, but it's all voluntary, so it's not forced. So that's usually the way it's done: is an assessment, some computer tasks, and at the beginning on up front, and then we do treatment, and treatment is open. That's either cognitive behavioral therapy, medication, or both, depending on what the patient and the parents want.
Dr. Berman, do you happen to have another slide that has your contact information on it?
Let's see, do I? There we go.
Okay, thank you.
Yes. Oops, I just went. Oh no, there we go. So do the second number through the 301-496-6642. That is the one I would focus on. Why? For two reasons. One, you get the direct, that's Lucy, our nurse who's been there as long as I have, so over 10 years. She's amazing. She's one of the ones who does the initial assessment. So she would also tell you, even for the individual, if they have OCD, GAD, or like social anxiety, if you're curious, we'll do a phone screen initially. Also, if you have any questions about the research and how much that entails, Lucy is really the one to call. Also, if you need referrals in your community and don't want to make your way to Bethesda or it's just too far, that's another option. We also we do hybrid options at NIMH now. So we do some in person, some virtual, and some mix as well.
Great, thank you. Well, Dr. Berman, we are at the end of our time, and want to thank you so much for speaking with us today. Did want to let our audience know that certainly please reach out, as Dr. Berman said, to her. We have a lot of resources also at the Family Resource Center, and please do let us know if we could be of assistance to you. But again, thank you so much, everyone, for your time today, and please enjoy the rest of your weekend. Take care.